Hi, I'm Mariga from Skin Essentials, and in this video I'm going to be talking to you about the benefits of microneedling and the differences between the microneedling that you would have done in a clinical setting and the microneedling that you can do at home. So I suppose the first thing to say is that I'm a big fan of microneedling. I love the fact that it is utilising your skin's natural healing and potential to improve the appearance of the skin. Because it is just a mechanical, actually I have a little thing here, I'm going to show you in a minute, the needles. Because it's a mechanical treatment using little needles to create channels in the skin, you're not introducing anything foreign into the skin, you're merely stimulating your skin's own little organelles and processes to upregulate, to work faster and to behave like they did when they were younger, which of course is what we all want. So the effect that will give you is a smoother, brighter, more even, tighter skin, tighter contours, and in the case of post-inflammatory hyperpigmentation, which is little pigmentation patches you might have left over from acne or from other areas of damage, sun damage or otherwise, it will help to lighten those a little too. And with the acne scars, it will really help to smooth everything out. So I did a little video yesterday about what not to do when, or what not to allow someone to do to you when you're having a clinical microneedling. So we'll speak about the clinical microneedling first. You're using, it can be a roller, we prefer a little machine that we use that has this little cartridge, is a sterile cartridge for each new person attached to the machine, and you can see here that there are little needles, a head of little needles on that. Okay, so they are set to the depth required for any person, and usually they're around there. It's really not as scary as it seems, we never go there. So it's they are preset for you for a particular depth to achieve whatever it is we're trying to achieve, again in a clinical setting. So because these are deeper needles than you would use at home, these are going right into the epidermis and to where the epidermis joins the dermis, so really into the structure of the skin. So a lot deeper than you'll use at home, and because they're going down that deep, you don't want to use anything foreign to the skin. So this is where, I kind of get frustrated when I see these things on the internet, or you read them in magazines about, needling in growth factors and stem cells and even acids. Scary, scary stuff. So we don't do that here. What we do is we mechanically make little channels in the skin which upregulates your own cell function to improve the appearance, texture and tone of your skin. The one thing that you can use, because it would actually hurt if you were doing this on a dry skin. So we use just a sterile water. You can also use, and it's okay if you're having your needling somewhere else to ask, you can also use hyaluronic acid to help with the end result, because hyaluronic acid is natural to the skin. So it's not going to cause any problems. But anything else is an absolute no-no in clinical needling. So by all means, have this done. Please have it done with us if you can come to where we are, because as I've said earlier, we are educated in advanced microneedling and you're in perfectly safe hands here. There won't be anything strange going on your skin. But if you are not in Ireland, watching this video somewhere else, having this done somewhere else, if you ask what is going to be used as the medium for the microneedling, if you hear anything except pure hyaluronic acid, my advice to you is do not have it done in there, have it done somewhere else. So that is clinical microneedling and the questions you should ask and what you can expect. Home needling is a little bit different, at least again in the Skin Essentials way. When you buy a home roller from Skin Essentials, the needle depth, the maximum needle depth you're going to see is 0.25, which is 1/4 of a millimeter. So at that depth, you can use your home roller to introduce products, ingredients a little deeper into the skin, because you are only penetrating the stratum corneum, which is the very surface. With your home roller, you can use your hyaluronic acid serum or some others that we may recommend for you, because they're not going in any deeper than they should be. They're not going deep enough into the skin to be seen as a foreign body in the skin. So for your home microneedling, by all means use your hyaluronic acid, your Skin Essentials hyaluronic acid serum. You can use that before the needling, use it after, and you can use the nourishing oil afterwards as well. So two different things. So the clinical needling is for revision, it's going deep into the skin, it's for deep stimulation of the skin's processes, and your home needling is more for penetrating your products in a little bit deeper, but still only at the level that they should be in the skin. And also it does help to maintain your anti-aging and anti-scarring results from your clinical microneedling. So I do hope that explains the difference, and please don't be afraid of microneedling. It's really a fantastic tool when it's used correctly, and if you have any questions about it, do call in to us here at our clinic in Selsker Street in Wexford Town. We'd love to talk to you. Give us a call or send us an email, and I will leave the contact details in a little box up here. Thank you very much for listening.